Alrighty, so we are at the 104 mark, so I'll go ahead and get started. So good afternoon, everyone. Thank you so much for joining us for our Instagram Live commemorating World AIDS Day, which was held on Thursday, December the 1st. My name is Jason Hernandez. I am the NHMA Programs Manager here, as well as the Programs Lead for the HIV Pact Agreement that we have with the Centers for Disease Control and Prevention. Joining us today, we do have Charlotte Kruger, Senior Communications Coordinator from HealthHIV, as well as Sarafina Cooper, Programs and Grants Manager from the American College of Preventive Medicine. So first and foremost, I wanted to just thank our panelists for joining us today, and we look forward to having a productive conversation as it relates to HIV care and treatment. So to give you all just a very brief overview of World AIDS Day. It was founded in 1988, and it was the World AIDS Day was the first ever global health day. So we're really excited to have a conversation with you all about World AIDS Day. And as I previously mentioned, it does take place on December the 1st each year. And it gives everyone an opportunity to basically have a conversation regarding HIV, unite together and show support for people living with HIV, people who have also, it allows us to commemorate as well as people who have died from AIDS-related illnesses as well. So with that being said, I'll turn it over to our panelists to introduce themselves and kind of give a brief overview of what they do in terms of their organizations and how it relates to HIV care. So with that being said, I'll turn it over to Charlotte.
Hi everyone, my name is Charlotte Kugler. My pronouns are she, hers, and I work with HealthHIV. So on the communications team, I basically am responsible for coordinating everything between our organization and other organizations to do with promotion of activities, educational materials and resources that we produce, webinars that we put on, other events such as happening right now, actually, our National Synchronicity Conference. And also a big part of my role at the moment is helping on our partnership with CDC's Let's Stop HIV Together campaign. So I'm responsible for a lot of the work that goes into that campaign, which is related to coordinating a lot of interstate and national efforts related to ending the HIV epidemic.
Alrighty, thank you so much, Charlotte, for sharing. With that being said, I'll turn it over to Sarafina.
Hi, I'm Sarafina Cooper, she, her. I work with the American College of Preventive Medicine as a program manager. The majority of my role includes managing day-to-day operations with our grant portfolio. ACPM is a medical specialty society, so we support our preventive medicine resident physicians and also residents in preventive medicine. And so another part of my role is working with our great marketing communications team and promoting the CDC Let's Stop HIV Together campaign.
Alrighty, well, thank you so much both for joining us today. We really look forward to having a productive conversation. As I'm sure we've all heard, we do a lot of work with HIV care and treatment overall. So with that being said, I'll turn it over to our first question here. So the first question that I have for you both, and I'll start with Charlotte, is why is it important to recognize and address World AIDS Day?
So basically, I feel like World AIDS Day allows organizations and individuals coming from everywhere across the globe, all different countries and cultures and contexts, to come together around this commonality of raising awareness about HIV and AIDS. And it kind of serves this dual purpose, as you both kind of touched on before, about how we're honoring people who have passed to this illness, and also, and in part because of people's failure in the past to really study this illness and to approach it in a compassionate way without so much stigma and homophobia and transphobia that has happened and continues to happen. So we honor people whose lives have been lost, but we also celebrate and commemorate the steps that we've taken as the years have gone on to try to right some of those wrongs and continue working towards a future without HIV and where people are supported in living healthy sex lives and in being able to reach out and make connections when they have questions about their health without fear of stigma and discrimination.
Thank you so much, Charlotte, for sharing your insight. And of course, we do see it as an opportunity as well to commemorate, the lives that have been lost, but also seeing what wonderful advances there are in the future as well. So with that being said, I'll turn it over to Sarafina.
Hi. Yeah, I agree with everything that was just said. For us, I think it provides an opportunity to talk about it openly, reduce the stigma, and encourage prevention care. It impacts everyone across the world, so it's really important that clinicians are aware of how they interact with their patients and the knowledge about their background, and starting those conversations and providing the most up-to-date care.
Perfect. Thank you so much. So with that being said, I'll turn it over to our second question, which is a little bit more of kind of what your organizations do overall. So if you could both tell us a little bit more about the communities that you serve, what are the primary barriers that they currently face that inhibit them from accessing PrEP and other HIV services? So with that being said, I'll turn it over to Sarafina to start off.
Thank you. So we are a little bit different in that our primary service is to our members of the medical society, specifically preventive medicine physicians. And some of the largest barriers that our physicians face is delivering care around the stigma, HIV, and how to start those conversations with their patients and communities about early prevention and screening. And so it's really essential to break down the stigma and ensure HIV prevention is part of routine care. We want to address the barriers of just the lack of awareness and knowledge of up-to-date PrEP and clinical guidance around HIV as a major component of preventive services. We strive to improve healthcare knowledge and prepare preventive medicine physicians to discuss and prescribe PrEP with their patients and be a part of the overall preventive medicine continuum of care.
Thank you so much, Sarafina. And kind of along those same lines here at NHMA, we do similar work in terms of empowering our Hispanic physicians to lead the efforts to improve, the health of the Hispanic community, and then also other underserved populations as well that might not have the same or similar access. So I'll turn it over to Charlotte.
So at HealthHIV, we directly interact mainly with providers, people who medically serve other people. And a lot of our providers are primarily serving underserved communities. So people with HIV, people with HCV, people who use drugs. So we reach a lot of the people and organizations who work directly hands-on with those populations. And to that end, we provide medical education, we provide training and resources that are tailored towards different provider types and towards the communities that they serve. So some of the barriers that we try to address and to help these providers address include stigma, discrimination, racism, homophobia. Socioeconomic barriers are a big one, as are related kind of wraparound services like transportation, food, housing, and a lot of those social determinants of health are things that our trainings and programs and materials try to help providers address for their patients.
Thank you so much, Charlotte. So as a follow-up question to you both, I kind of wanted to get a better sense of also what does HIV health equity look like to you both or to your organizations overall? And I'll start it off with Charlotte.
So for us, health equity looks like so much. There's a lot that we're trying to work for and pave the way to happen. One thing would definitely be increased access to PEP and PrEP. So financially, socially, building the kind of social and communal environment where reaching out with questions about that medicine, if PrEP is right for you, feeling comfortable to engage in an open dialogue with your provider about PrEP. That's something that is huge for us. And when we're working with providers, we try to train them on ways that they can engage basically everyone in normalizing the conversation about HIV, since HIV does not look like one race or one sexual orientation, one demographic. That being said, there definitely are populations that are disproportionately affected by HIV. So addressing that inequity is equally as important as normalizing discussion of HIV and kind of breaking down stereotypes and stigma.
Thank you so much. And just to kind of chime in there also, I think the importance of quality healthcare overall, I think is a great point that we should touch on, as well as that, everyone deserves the equal amount of access and to be able to understand and be able to have, services that are available to them that they're able to carry out then through over. So with that being said, let's turn over to Sarafina.
And so preventive medicine really focuses around, and their physicians are placed in a really optimal position to address and work on upstream approaches, really looking at social determinants of health. And that's really where health equity starts with us, for folks to have the opportunity to attain their highest level of health. So we really work at community resources and discussions to address those social needs, such as housing and food and access to other forms of care and resources. And I think that really feeds into ensuring that we're able to take the next steps to HIV testing, treatment, and additional anti-stigma work.
Great, and that kind of leads me also into my follow-up question. So what steps have you or your organization taken to address the health disparities in the communities that you serve? So I'll start off with Sarafina with that question.
Yeah, we work with our physician members, and also we work with the residency medical programs and our partners to support and amplify their voices, and specifically those that work in those priority jurisdictions or those who experience disproportionate rates of HIV, such as Black and Hispanic and Latino communities. So we work with them as in a core set of ambassadors within our membership to lead the voices for HIV prevention. And they also share equitable and anti-stigmatizing healthcare practices and best practices for communication. And that's a main portion of our work is with the ambassadors, and then also they help, our members and ambassadors help with disseminating physician-focused materials and resources such as the CDC's HIV Nexus toolkit, and then we share those at major medical events, health publications such as Health Affairs and the American Journal of Preventive Medicine. And so those are some of the activities that we've had in place to increase physician awareness of those existing disparities and ways that they can implement interventions and pivot their healthcare delivery and practices.
Thank you so much, Sarafina. And just to join in really quickly, NHMA also does exhibit at different conferences. And it's funny that you mentioned the HIV Nexus, because that's a very big resource that we do push out to different clinicians as well as public health departments as well. And so with that being said, let's turn it over to Charlotte.
So in terms of addressing health disparities, one thing that we've recently finalized and have been trying to spread the word about is our HIV Prevention Certified Provider Certification Program, which basically allows providers not only to partake in this free accredited training for providing HIV care in a medical sense, but it also has integrated throughout ideas about cultural responsiveness, cultural affirmation. So being able to work with clients who are coming to you from all backgrounds, all walks of life, people who are also of different health literacies and just coming from all different perspectives. so that HIV care, just because you're in contact with a provider, doesn't necessarily mean you're going to stay in care or feel affirmed and feel met where you are. So this program is something that really helps providers take that extra step to really connect to their patients and to deliver care that is not just for the body, but also for their emotional well-being and to feel comfortable being in care as the person they are.
Well, thank you so much for sharing. And I love that you also touched upon the importance of cultural responsiveness, which leads me into my next question as well. So if you both could discuss the importance of cultural responsiveness and its impact on HIV care. So Charlotte, I'll let you turn it over to you to add on anything else.
Sure. So basically, we see cultural responsiveness as being affirming of cultural differences and appreciative of diversity. So those differences can look like nationality, where people come from, immigrant status, race, language spoken, multiple languages spoken, even just regional differences within the US and where people grew up, if grew up urban versus rural. So there's really a lot of cultural aspects that people have, and that can come into play while in HIV care or really in any kind of medical setting. So that's the kind of awareness that our trainings try to bring to providers on this front.
Thank you so much, Charlotte. Sarafina?
I agree with Charlotte. Cultural responsiveness is really incredibly important to patient satisfaction and quality of care, definitely considering the historical context of minoritized and marginalized communities. Building that stress, addressing communication problems and cultural barriers are really important to address those negatively stereotypes and terminologies or antiquated thought processes around health that can negatively impact the care that patients receive. It really has all to do with respect and showing that patients are cared for and that not all, healthcare delivery serves everyone in the same way.
Well, thank you so much, Sarafina. And I appreciate that you also touched upon addressing the negative stereotypes, because I think it's also important to look at patients holistically and be able to address, different aspects that might not be certainly looked at in terms of, accessing HIV care, but also in terms of addressing the negative stereotypes. Also leads me into my next question in terms of what next step will it take for us as a society in terms of us achieving full health equity to end HIV? And I'll start off with Charlotte.
So I think there's really lots of steps. It's kind of hard to pick just one, but I think definitely stigma, addressing stigma, constantly trying to be aware of the way that we talk about HIV and the way that we talk about also social determinants of health is something that can really go a long way, both on an individual case-by-case basis and also more in terms of sociological trends with trying to help people feel comfortable just talking about this stuff and not having it be something shameful, something secret, something that you're terrified of, just something that is a medical condition. There's all sorts of medical conditions that people can have, and there are ways to treat them, and there are ways to be supported. So I think that addressing stigma head on, being conscious of language we use, like Sarafina has talked about, and beyond that, I think that there are a lot of structural issues, a lot of stuff to do with insurance, the healthcare system in this country, which I do not want to derail this presentation by going off on a spiel about that, but I'm sure you all know exactly what I'm alluding to. I would say that addressing that is necessary for ending the HIV epidemic or any other epidemic, really.
All right, thank you so much. Sarafina?
And I agree with everything that's been said. And it goes back to our earlier efforts of working with our community, the physicians that really are in those local areas with their communities. They represent them. They know their patients, and the work to destigmatize HIV, early detection, and the treatment of HIV. It's really important within all healthcare delivery, within all of the care continuum and specialties, just not within preventive medicine. And so that's really important for us to just continue that work with our physician ambassadors. They've done amazing activities and have amazing strategies with other projects, and as far as leading peer educators, mobilizing community health workers, taking care directly within the communities and residences. So I think that's really important for us as we champion for HIV prevention.
Great, thank you so much. And we are running a little short on time here, so we do have 2 more questions. My follow-up question to you both was, what resources do you or your organization offer to support communities that are impacted by HIV? And I'll start off with Sarafina.
Yeah, so we provide resources on our website so that our members can directly come and see the repository of the CDC's Let's Stop HIV resources and toolkits and social media. And then they can also download the search tool to put on their front pages for their patients to search for local HIV care and resources. And then, like I mentioned earlier, also promoting the CDC's HIV Nexus portal so they'll have up-to-date information.
Alrighty, and then Charlotte?
Definitely seconding Sarafina's mention of Let's Stop HIV Together at the CDC. That is just a phenomenal resource repository for basically everything you could need as a provider to try to raise awareness about HIV and treatment, prevention, and all of that. On Health HIV's front, I would mention our pleaseprepme.org database, which is also a repository of resources, but it is state specific. So there's resources tailored to each state. There is a searchable directory of PrEP and PEP providers for each state. So clients, consumers who go on there can find a PrEP provider in their state. And there is also just a variety of sexual health and related resources that are available on Please Prep Me.
Thank you so much, Charlotte. And before we end today's IG Live, I did want to also just chime in very quickly. So besides the Let's Stop HIV Together campaign, which is a great resource as well as the CDC Nexus, the NHMA also does offer the HispanicHealth.info portal to both providers and patients to provide or to have up-to-date information specifically to HIV, but also it has materials in both English and Spanish for a plethora of information. So that leads me to my last question. How does HIV stigma impact HIV testing and treatment? And are there any strategies that can be implemented to combat HIV stigma? And I'll start with Sarafina.
I think it really, going back to that historical context, it can discourage folks from seeking out HIV care. And that goes back to an earlier point too, that's it's also important to identify other social needs. Some folks, health is not their priority, and that's not a bad thing. There's so many other things coming against us, definitely in the aftermath or continuation of COVID-19. Some folks don't have access or time to address their health, so I think those 2 things are really important in showing that care and showing that you want to provide access to other things like food and transportation, and that holistic approach is really important in that respect, so that folks aren't discouraged to seek out care and prioritize health.
Alrighty, and then Charlotte?
Yeah, I definitely agree, and I think that that's a really good point about all the competing priorities and everything that people have to deal with. And when health is just one of those things, it's like, how do you decide what you're going to do? So yeah, definitely making healthcare easy to access, and then when you access it, responsive to your individual needs and your context of where you're coming from. And that would include mental health as well as physical health. So it's all part of what's important. And really, I feel like the least that can be done is to offer services that are free of stigma, so that people aren't discouraged from seeking healthcare when it's already so difficult to do sometimes.
Alrighty, thank you so much, Charlotte, for sharing. So we are right at time here, so I just wanted to say thank you to both of our panelists for joining us for today's conversation. We hope that it was very informative, and you all were able to learn a lot more about what we all do in terms of HIV care. So thank you so much for the panelists, and thank you so much for the viewers as well. We hope you all had a great time. So thank you so much.
Thank you.
Thank you.
Thank you.